People were extremely depressed, fearful for their lives, afraid to walk outside.
You just needed to talk to someone so badly that it was kind of like, whatever I got to do.
I think the opportunity has been very eye-opening for us. We didn't realize how powerful this platform actually is.
Telemedicine exploded during the COVID-19 pandemic, when the national shutdown went into effect in March 2020, and just stepping into a doctor's office posed a potentially deadly health threat. We all had questions, but there seemed to be so many answers. Could telemedicine be the solution we all need? Join me as we hear from patients and medical experts, including our nation's Surgeon General, on the role telemedicine plays in our healthcare. Let's own your health, starting now. Hi, I'm Dr. Geetha Nair. I'm so thrilled to be talking to you today about telemedicine and the many ways doctors and patients can interact from virtually anywhere. I'm a rheumatologist, and I've dedicated my career to some of the most vulnerable patients, those who are immunocompromised and have chronic diseases. I know firsthand the barriers to care my patients experience, and that is why I'm so thrilled to be talking to some of the leading experts in both healthcare and technology about telemedicine. Plus, we'll have a surprise guest commentator, my 9-year-old. With COVID numbers rising once again, the ability to see your doctor in the comfort of your home has never been easier and more of a necessity. A Palm Beach Gardens internist tells us telemedicine saved many lives when the pandemic hit.
Everybody was extremely frightened. And as you can imagine, being a general practice, the first place people are going to call is here. In terms of the COVID, they're not going to call their dermatologist or their cardiologist, they're going to call here. So, we had the phone lines all jammed up from people just panicking and not knowing what to do.
Dr. Daria says the initial telemedicine visits were spent calming fears.
The trust is paramount in the doctor-patient relationship, and I think that just them knowing that we were here, just them knowing that they could call and we could see them and they could see us, was so important.
Some telemedicine visits were used as a first step to determine if the patient's condition called for an in-person visit.
We had some patients who had some symptoms of COVID and really didn't know what to do. They were scared to leave their house. They didn't want to infect anybody. So we were able to see them on video and talk to them and know the level of distress they were in, whether it was respiratory or anxiety or having problems breathing or really bad cough, high fever, chills. We had 1 or 2 patients that were in bed, and the relatives called in and we did a video and we saw them, in their beds, and we told the relatives, you need to call the ambulance.
As an internist, Dr. Daria sees people from 18 to over 100 years old, many with chronic conditions.
I think that, with the advent of technology, we now have home blood pressure machines and home blood sugar machines and all types of devices. So we would prepare them by calling them and saying, okay, take your blood pressure, take your weight, get these metrics for us. And, just the look on the faces of a lot of the patients was relief. Relief that, they could see the doctor, they were stuck in the house, they hadn't been out for weeks.
Dr. Daria is hopeful a patient's option to use telemedicine will become a standard of care.
I would love to incorporate this into the daily practice for patients that travel when travel is ready and open, for older patients that have transport issues, for patients that have problems with vision, that have a hard time getting to the office, for patients that rely on family members and family members' schedules and jobs where they can only come in at a certain time, and for patients that have a perpetual fear of worry that their ride is going to be late, the bus is going to be late. I think the opportunity has been very eye-opening for us. We didn't realize how powerful this platform actually is.
Thank you, Dr. Daria. According to fairhealth.org, from March to June 2020, 30% of all outpatient activity was conducted via telehealth, compared with less than 1% in 2019. Ann Munn Johnson is focused on transforming the healthcare industry as the Chief Executive Officer of the American Telemedicine Association. Founded in 1993, a nonprofit organization that is working to accelerate the adoption of telehealth. Ann, welcome.
It's a pleasure to be with you, Geeta. Thank you for having me.
What is the definition of telemedicine?
The way we define telemedicine is really the ability to connect individuals and their providers when in person is not necessary or it's not possible.
So to be clear, because a lot, there's telemedicine, there's telehealth, there's virtual care, there's a lot of different names out there. But to be clear, it could include a phone call, a text, a video visit like this. Is that right?
That's absolutely correct. There's all sorts of modalities.
So what have you seen with the pandemic as far as telemedicine? The ATA was founded in 1993. I'm sure folks didn't even think telemedicine was around then. What's been the change? Because now it seems like everyone's talking about it.
What happened pre-pandemic was that many people did not know what telehealth was or thought it was something that was just used in rural communities. And what's happened with the pandemic since March of 2020 is that a lot of people have started using telehealth. They found that it was a really convenient and effective way to get care. And the idea of really being able to connect with their clinician or with a medical facility if they had symptoms and they weren't sure if they were consistent with COVID.
Tell me what's being done at the federal and state levels to ensure that this continues no matter whether there's a crisis or not.
From the federal level, there was a public health emergency that was declared. And with that, then there were a whole host of waivers that were issued that made it easier for people to get care in ways that they had not been able to before. One of the interesting things that has happened with the pandemic is that people are realizing that some of the rules or laws that were put in place that govern telehealth or telemedicine were put in place in 1997, which is 14 years before the iPhone was invented. So if you think about it, it's hard to legislate when you didn't know something was possible, right? So now with the waivers that allow for much greater flexibility in terms of where people get care, the type of care, that audio, using a phone and just a phone to consult with your physician or your clinician, those are the sort of things that happen at the federal level.
And thank you so much for everything that you do. Thank you to the American Telemedicine Association. We clearly need you. We appreciate you connecting doctors and patients online. Thanks so much for joining us.
It's an honor. Thank you.
And another voice from the ATA is Dr. Joseph Kvader. He's chair of the board at the American Telemedicine Association. Dr. Kvader is a dermatologist. He's on the faculty at Harvard Medical School, and we asked him about the history of telemedicine.
The concept has been around for a very long time. A lot of people date the modern origins to a system that was created at my institution, the Massachusetts General Hospital, in the late 1960s by a doctor named Ken Bird, who used a microwave link to provide services to a clinic from the hospital to Logan Airport.
Dr. Kvader, when it comes to technology, patients always voice their concerns about privacy. What do you say to that?
We can't shy away from it. It's really critical. In this day and age where people are getting ransomware and hacks and so forth, we take it incredibly seriously. The privacy concerns, however, are more about where your information is stored and who gets access to it than the actual risk of any intrusion on your video conversation with your doctor or however else you're communicating with your doctor. In other words, the communication link is much less interesting to hackers than the information about you.
Privacy is so vital. Thank you to both Dr. Kvader and Ann Munn Johnson from the ATA. I'm pleased to sit on the board of this organization to support the contributions telemedicine makes to our healthcare system. The ATA will hold its first ever Telehealth Awareness Week, September 19th through the 25th. Before the pandemic hit, a Broward County woman was feeling better than ever using a new treatment for sickle cell disease. But with the Centers for Disease Control warning that people with chronic medical conditions were at risk for severe illness or death from COVID-19, her medical care was thrown in jeopardy.
I am a filmmaker, documentarian and writer. I'm also the founder of Unstoppable Films, which helps to promote disability and diversity inclusion in film. When the pandemic hit, I was very concerned, and I was afraid, because if I get a cold, or if I get a cold catch it from someone else, then I would have the flu. And if someone had the flu, I could have pneumonia. So I was very concerned about what could happen to me if I caught COVID-19. I have sickle cell disease. It's a hereditary blood disorder that causes lack of oxygen to your organs and also creates immense pain in your body. So it's a chronic illness, like a chronic pain disease. I didn't even leave the house for a long time. Going out really gave me a lot of anxiety, and just wondering what life would be like for me, for my family going forward. I have to see a lot of doctors, a lot of different specialists. I have a hematologist, a pulmonologist, gastroenterologist. There's so much to go on, and then I have a monthly blood exchange where they take out 2 liters of my blood, and they put in about 8 units of healthy red blood cells, which helps to diminish the pain that a crisis can bring on, and just help me to have more oxygen and for my blood to flow more freely. My doctors were so concerned that they canceled all of my procedures, because I do the procedures in hospital. And so they were like, we don't want to take the chance of you coming in to get a procedure to save your life, but then you possibly getting COVID. All of my doctors transitioned to telehealth. I had never even known that telehealth existed before the pandemic. I've always wished when I'm busy that, or something happened, that there was an opportunity, especially on days that I just was feeling so tired or ill that I couldn't make it to my appointment, that this had been an option. I felt comforted by telehealth, having telehealth in that. I also felt like my doctors were listening a lot more intently than I feel that they do when I go in for a visit. I feel like it's very quick. Sometimes when I go in and they're on the rush because they have so many other patients. But with telehealth, it's like, I know that this time is allotted for me, and they want to know everything that I have to tell them. My doctors were already at work, making sure that I was, first up to bat to get the vaccine. So I got it fairly early. I think I got my first dose in February. So I was grateful for that. And then everyone else in the family kind of came aboard. So everyone is interested in keeping each other safe. I ended up on new medication that took the place, or not necessarily took the place, but really helped to build up my blood and my system while we waited for things to subside, and I can go back to getting my blood exchanges. I would like people to know that telehealth is accessible for everyone. It should stick around. It should definitely be something that people should be more aware of, or that awareness should be built around it. I think that a lot of people don't know about it, or that it was available. And I think that as, COVID subsides, hopefully, that it doesn't go away, because I feel like it definitely helps to keep people more focused on their health.
We're so glad that Juliet is doing well and can continue to use telemedicine whenever possible. Welcome back to Own Your Health. We've heard about the experiences adults have had with telemedicine. Now let's hear from the next generation of telehealth users. I asked my daughter, Sonia, to weigh in.
they could make this closet full of like doctor stuff, and then you could press doctor and a robot would come out and like be your doctor, or you could just get the stethoscope out or anything if you just want to check your heartbeat or just check your blood pressure. But if you want an actual checkup, you can do the whole robot thing.
Do you have a message for any of the kids out there?
Wear your mask.
Thanks, Sonia, for sharing your thoughts. Telehealth opens the door for people to get care when they need it most. A weekend, after hours, or when a busy parent or guardian just can't get to the doctor's office in person.
Like most busy working parents, the juggling act gets even more difficult when someone gets sick.
Does he have any twos?
When so many doctors' offices were closed at the beginning of the COVID-19 pandemic, Carly Fabricant of Jupiter turned to telemedicine for medical care.
My son had an infection on his toe, and so that's something visual, that they could see through the camera. So having that knowledge, what can you use it for, was helpful. And I had an allergic reaction. So I have bad allergies, and so I called, because again, something you can see through a camera. During COVID, of course, there was an advantage not having to go and expose yourself to the doctor's office, but for a working mom is obviously the time that it saves. I often hesitate, like, do I need to take the kids to the doctor for this? Can we just call up? And often the nurses are good. They'll tell them the situation, and they'll tell you what you need to do, if you need to come in or not. But for something like that, like pink eye or an infection or something that they can see, it's very convenient to not have to leave your house.
We're going to talk about produce today. That's going to be our focus for this grocery store tour.
Fabricant was already familiar with telemedicine as the wellness coordinator for the Palm Beach County School District. Her job is to create programs that will enable a workforce of 25,000 to take better care of themselves.
Not just on the medical side, but also from now more than ever, of course, the well-being of the employees. And they are role models for the students, so it impacts the students and how well they are, how well they're able to handle stress, the environment in the school. We work a lot on school culture, so that they can set a good example for the students, take care of themselves. Of course, we don't want teachers out of the classroom.
Educational efforts are paying off. Telemedicine use is up at the district.
If you use it, if you understand it, you like it.
Thank you, Carly. I can relate to the struggle of being a working mom, and the virtual visits really help with time management. Dr. Adrian Burroughs is a family physician practicing in the Orlando area. He specializes in family medicine and geriatric care. Dr. Burroughs, it's so great to see you. Thank you for joining us.
Thanks for having me on. Thank you so much.
Talk to me about what you've seen through the pandemic and how you've seen telemedicine being utilized.
Well, thank you. So I had been thinking about using telemedicine services since 2015. Really could not find the right person to deliver the services in my office, and we weren't really being reimbursed as physicians for that service. So we never actually got it off the ground. Of course, the COVID-19 pandemic started. We started having patients with lack of access to care as a result of that, just being afraid to come to the doctor's office. And a lot of times we were closed and we couldn't, to certain type of patient groups. At the beginning, people with respiratory symptoms and fever, we weren't seeing in our office. And so we were able to roll out telemedicine as a result of some of the changes in the laws regarding HIPAA and privacy and things like that, and the security of those types of systems. And so that's kind of how we got started in utilizing telemedicine services.
So you specialize in geriatric care. Are you finding that the elderly is also embracing these kinds of technologies?
Yes, surprisingly so. About 50% of my panel are patients over the age of 65. And so one of the things that had also delayed us in proceeding with telemedicine is because we weren't sure the elderly were willing to utilize the type of devices you would need to do that. But lo and behold, they're pretty adept at using those things. And so that's helped quite a bit.
One of the things that continues to plague us through the pandemic, that's continued to systemically plague the healthcare industry, is the underserved. When we think about the Black and Brown communities that have been affected not just by COVID, but by diabetes, by hypertension, by obesity, by misinformation. Do you see telemedicine as a viable solution to reaching the areas that we've really struggled with historically in healthcare?
Absolutely. And, having grown up in an underserved community, being part of an underserved population, lack of access to care has always been an issue. And, that's going back decades. One of the things that telemedicine has been able in some cases to help is to be able to open the door to allow those patients the access to physicians and often physicians that they may have wanted to see, but they had no access to. It still has been a challenge because in order to have telemedicine, you have to have a device to use telemedicine. And in some of the Black and Brown communities, that they don't have, a smartphone or something like that where they can utilize those services. So that still remains somewhat of a barrier. But for those who do have those devices, it has definitely opened up access.
We've been through a lot this past year, all of us, doctors, patients, everyone. What do you think the future holds for the healthcare system and how we're going to be seeing patients in the future?
I think that we've opened Pandora's box now that this telemedicine technology has been made available. I don't think we're going to be able to pull it back. It's exceptionally convenient for a lot of patients to review things like lab results, for diagnostic testing, to deal with things that are minor. Things like a rash, something that your doctor can actually visualize via this method. And I think this technology is wonderful, but we have to incorporate it carefully.
Dr. Burroughs, we thank you so much for your advice and your time. For all the folks watching, make sure you follow him. Thanks, Dr. Burroughs.
Thank you so much.
As the U.S. Surgeon General, Dr. Vivek Murthy serves as the nation's doctor. With so many still unvaccinated against COVID-19, Dr. Murthy is calling for a war against health misinformation. Thank you for joining us, Dr. Murthy.
Of course, glad to be with you today.
So, Dr. Murthy, I'm a huge fan. So many doctors around the country are a huge fan. We applaud your work, especially at these historic times. You've really talked so much about misinformation, disinformation, the role of technology. Can you start us off today just giving us the definition? What is misinformation?
The challenge of health misinformation, I think, actually makes the job of doctors and nurses even harder. So what is health misinformation? Well, it's information that's false, inaccurate, or misleading according to the best evidence we've got at the time. And while health misinformation is not new, people have been peddling false information about health for centuries. What is different now is the speed, scale, and sophistication with which it is spreading, aided and abetted by technology. And so a couple of weeks ago, I issued a Surgeon General's advisory on the danger of health misinformation to draw the country's attention to the fact that this is a public health threat and one that we have to marshal our collective resources to address because our health depends on it.
How does the average physician scale? Could telemedicine be that solution? Could we bring that personalized connection to the places that don't have that connection or don't have those resources?
We saw really the pandemic forced us to use telemedicine and to adopt it at a much more accelerated pathway. And that perhaps might be one of the silver linings of this pandemic. But the real question is, what do we do from here? Do we continue to support and expand the reach of telemedicine? Do we close the broadband gap that prevents some people from having access to telemedicine because they don't have access to the internet or to digital equipment? And how do we make sure that these services are adequately valued by insurance companies and other payers so that they remain a core part of our infrastructure going forward? Those are some of the key questions that we have to address now. But I think it's important that we do it. And if we do, not only can we just generally expand care, but for mental health services, for the counseling services that are an important part of substance use disorder care. We know that in rural parts of our country that these services are scant, and it's been hard to get specialists to go to rural areas in sufficient numbers to provide the care that's needed. So that is particularly where telemedicine can make such a big difference, and why I think it's going to be a key part of our equity strategy.
Dr. Murthy, thank you so much. What great advice. I look forward to seeing you sometime here in Miami with my little one as well. Be well. Thanks so much for joining us.
Well, thanks so much. So nice to be with you today.
It's no surprise that the COVID-19 pandemic has had a profound impact on mental health. Let's meet a Palm Beach County therapist who was ahead of the curve when it came to offering telehealth visits. But it wasn't until the pandemic hit that the virtual visit became a lifeline for many.
About 6 years ago, I decided that I wanted to start my own platform for telehealth. It was my first business, and I poured all sorts of heart and soul into starting ED counseling. And what I noticed after I had the website running was that the feedback I was getting was that people didn't really want that. They said, well, you're going to miss out on the opportunity for nonverbal communication and the energy. And I thought that there was a place for it, and then nothing really happened.
That was 2014, long before COVID-19 emerged, and everything changed.
People were extremely depressed, fearful for their lives, afraid to walk outside. They're talking through windows because they were so fearful of walking outside. They're wiping down their groceries. Hi, how are you?
Soon, Tomko says patients started requesting video visits, longing for that social connection.
I started researching platforms that were going to be HIPAA compliant, and we just started offering it as a service. And then we realized how easy it actually was. And then a large percent of our clientele ended up utilizing it.
Eileen Carradine was going through a crisis when the pandemic hit. She was seeing a marriage counselor and a personal therapist when those visits were suddenly put on hold.
I did a lot of reading. I did a lot of listening to podcasts and really anything that I could get my hands on that would make you feel like, okay, I'm not alone in this, and to see how other people dealt with it. I felt like, you know, at least for what I was going through, I needed that third party to make sure that, hey, was I thinking clearly? Was he thinking clearly? Were we making strides towards something, or was everything just stagnant?
Fortunately, Carradine found therapists who offered virtual visits. She began thriving again, taking advantage of the flexibility televisits offer.
You just needed to talk to someone so badly that it was kind of like, whatever I got to do. I mean, there were days where I would be at work when things returned to normal, and I actually had to go back into the office. Doing it that way offered me, during my lunch hour, I needed those conversations some days just to get through work.
There was a period of adjustment for the patients and some providers.
How was your week? Initially, when I converted over to telehealth, it was extremely difficult for me to push through the screen to get a connection with the person. But after doing it a few times, I was able to kind of just tune in. And then I didn't feel like it was that much different. Like, I was so in tune with the person that I didn't even realize that the screen was a barrier, and we had that distance between us.
The therapy provided using telemedicine became and still is a lifeline for many.
I feel stronger than I've ever been. And I know that there's still a lot of work to do, but I really don't think that I would be where I am today had I not made this a priority of mine and taken the time to dedicate myself to really looking inward and having good quality therapy there to help me along the way.
Thank you, Eileen, for sharing your story. We're so glad you're feeling stronger. The growth of counseling through virtual visits is expected to continue thanks to the enhanced feelings of safety, security, and privacy for many. Welcome back to Own Your Health, where we're exploring the many aspects of telemedicine. Let's meet an early adopter of technology in the field of medicine, a healthcare futurist. Dr. Raphael Grossman is a full-time trauma surgeon. He was one of the earliest Google Glass explorers in the world, and he was the first doctor to ever use Google Glass during live surgery, allowing medical students to watch the surgery through Dr. Grossman's lens.
Thank you. Thank you very much. It's my pleasure to be here and share some time with you.
You have such an amazing story. The first live surgery through Google Glass. Tell us about that. How did that come to be?
Well, that was really being at the right place in the right time, I think, and having a little bit of inventiveness. And I was in Silicon Valley doing Future Med, which is now exponential medicine. And I was able to hear Babak Parviz, one of the inventors of Google Glass, and not just talk, but also demonstrate how Google Glass worked. And when I saw the power of that device, basically a smartphone mixed with a computer on your forehead, and I could see how that was enhancing how we could communicate with us and stream pictures and video and connect to the internet and ask questions. And I thought this is going to change how we do healthcare.
Dr. Grossman, do you have any advice for our audience who's never used telemedicine before?
Well, I think that the best advice is having common sense, I think, and having your own criteria to be curious, to read, to explore what's out there, and to make sure that whatever technology is out there is not a substitution for the human touch, right? For human connection. Those technologies ought to be used to augment, to enhance that human connection. Is not a substitution. And no matter what you're using the technology for, in what field of human endeavor you're using the technology, I think that it's good to keep in mind that technology is another addition, and like anything good or bad, it shouldn't be done in excess, right? I think that common sense in how we use these tools is really very, very important. So that'd probably be the best advice I can give.
Dr. Grossman, thank you so much for all of your insights. We've really enjoyed talking with you today.
My pleasure. My pleasure. Thank you very much for giving me the opportunity, and hope to stay connected. Thank you.
The ability to consult with top medical experts across the globe without the cost of travel is one of the main benefits of televisits in many fields, including ophthalmology. Dr. Rania Habash is the Medical Director of Technology Innovation for the Bascom Palmer Eye Institute at the University of Miami Healthcare System. Dr. Habash, how is telemedicine used in your practice?
We actually have about 25 different types of visits, but some of the things that I use most are, for one, we have a very successful teletriage type of visit. And this is essentially, imagine instead of having to go to the ER when you have an emergency, there is a place where you can go and have a video visit instead and be evaluated by one of the Bascom Palmer physicians and be told whether or not you need to come into the ER in the first place, or if there's something that they can do to help you or route you effectively without you having to come in.
Dr. Habash, you see patients of all ages. How do you ensure that the patient knows how to use the software before the doctor's visit even begins?
So when we set up the appointment about 48 hours before, just like you're confirmed for a regular office visit, I'm sure we've all had that before, right? We also have a confirmation system where the agent then helps to make sure that they have the app downloaded, they accept cookies, or the microphone is on, etc.
Dr. Habash, you're an eye doctor. What do you see when you see the future of telemedicine? Do you think it's here to stay?
Yeah, there's no question we're not going back. And what we've been seeing is a lot more digital health technology that's coming out to the population. And so what actually we're seeing is this transition where patients are not really patients anymore. They're more like consumers. And just like they track their steps, their sleep, their calories, etc., they want access to their medical care as well.
Dr. Habash, thanks so much for your insights and your vision. Peter Hotez is a scientist, pediatrician, and advocate for global health and vaccinology. He is Dean of the National School of Tropical Medicine at Baylor College of Medicine in Houston and co-director of the Texas Children's Hospital Center for Vaccine Development. Dr. Hotez, welcome.
Thanks so much, Geeta. It's an honor to see you and be with you.
Likewise, likewise. So I love the title of your new book. How do we be diplomatic, right, in this era of misinformation, disinformation, in the middle of this crisis? Do you think that technology has a role to actually help solve this? When we think about telemedicine and kind of connecting folks to information and doctors. Any thoughts on that, Dr. Hotez?
Well, clearly we need innovation here because the old way is not working. Right now the anti-vaccine, anti-science groups dominate the internet. So if you try to download information about vaccines, with whatever search engine you use, chances are you're going to get garbage rather than real and accurate information. So, we need new approaches, and maybe telemedicine would be really key. So we've got our work cut out for us. So I'd be very intrigued to look at how we could use telemedicine to bring back the good guys and get some accurate information out there.
Dr. Hotez, I think you're spot on. So I have a 9-year-old at home. There are a lot of moms worried about back to school, still wrestling with the decisions about getting vaccinated. What is your advice? What's your message as a pediatrician to all the parents out there?
Well, certainly as a parent, you want to get vaccinated because it'll decrease the likelihood you can transmit COVID-19 to your other family members, including your unvaccinated children. Second, vaccines are now been released for individuals over the age of 12. Vaccinate your teenagers. That's really, really important. And then in terms of vaccinating little kids, I don't think they're going to be approved for younger kids until later on in the year. But in the meantime, if all the adults and adolescents get vaccinated, that will slow community transmission and decrease the likelihood kids will get sick.
Well, Dr. Hotez, I certainly hope that everyone out there gets a pediatrician. If they can't get access to one, I certainly hope they look for one virtually. Thank you so much for your time today. We appreciate you so much, and I look forward to seeing you in real life on the flip side of this. Dr. Sachin Jain has held several leadership positions in the federal government, both at the Center for Medicare and Medicaid Services and the Office of the National Coordinator for Health Information Technology. Dr. Jain, welcome to our program.
Thanks so much, Dr. Nair. Great to be with you.
So, Dr. Jain, you've worked on behalf of seniors in both the public and private sectors. What role do you see telemedicine have in providing for the care of our seniors?
I think telemedicine is a tool that can facilitate the care of seniors by increasing the ease with which seniors access healthcare. I just think about my mom and dad who live outside of New York City and often seek care in New York City. They travel, a long distance to actually get care. They have to park in a difficult to park in facility, all for a 12-minute appointment that could have been conducted by video. And so I think what I've seen for them, as well as many of the seniors that are now accessing telemedicine, is that a lot of care that previously used to require a visit to the office is being completed virtually. So I think the pandemic and some of the changes that followed from the pandemic have created an opportunity for us to rethink how we deliver care, how often patients need to come into the office, what they actually need to come into the office for. And so I think there's an opportunity for us to really rethink the delivery of care to seniors.
So in that spirit, I want to talk a little bit about technology and misinformation. We had Dr. Murthy on the program earlier, and he talked a lot about the role technology's played in spreading misinformation and disinformation. And so my question to you is, could technology be a possible solution? Could telemedicine be one of the technologies that helps us actually do away with a lot of the myths that we continue to see out there?
So I think we have to look to innovative partnerships between healthcare organizations and tech companies to actually solve this problem. I think it's a huge problem. I think especially among kind of the aging adults population that are increasingly consuming a lot of information from channels like YouTube and WhatsApp and other forums where there is a proliferation of information of modest to medium to low quality. And it's, I think, played a very significant role in actually potentially spreading, misinformation. And I'm in an increasing number of conversations with people at these technology companies who are interested in actually solving this problem because they recognize the extent to which public health is potentially being compromised using tools and technologies. And there's an increasing, I think, ethical recognition of our obligation to make sure that the health information that is out there is of high quality.
So it sounds like you see a lot of innovative partnerships as part of the future. What else do you think about when you think about the future of telemedicine? What is your prediction for 2022?
My prediction for 2022 is we're going to see more of these types of partnerships. I think you're going to see, an increasing number of organizations that have been traditionally bricks and mortar, starting to think about how they can enhance their care delivery models through telemedicine and build a device ecosystem along with that telemedicine infrastructure that will actually enhance the value of clinical care that's delivered virtually.
Dr. Jane, thank you for painting a beautiful future for us to all look forward to at the end of all of this and through all of this. We appreciate everything you do. Thank you for everything you do for our seniors, and I look forward to seeing you in person, hopefully next time here in South Florida.
Great to be with you, Dr. Nair. Thanks so much.
If you'd like to learn more about telemedicine, here are some resources for you on the web. You've heard from patients, medical and technology experts, and even the next generation. All of them say telemedicine is here to stay. We thank everyone for watching and hope everyone stays safe and healthy. And remember to own your health.